Chapter 8. By the end of this chapter, students will be able to
understand the impact of hallucinogens on the brain, understand the impact of culture on behavior, and to identify and practice skills to improve health outcomes. Hallucinogens are having a bit of a renaissance right now, and there is a lot of talk about what these drugs are, how they are used, and weighing the potential benefits versus consequences. It's important to know that students will bring these ideas to the table. It is best as an educator to be able to comfortably discuss how hallucinogens work and their benefits and challenges. Because of this video is going to be highly informational in nature, with the hopes that you will feel confident in answering students' questions. Depending on your student's age and comprehension, a bellwork activity could be a good place to start. Have your students turn and talk with a neighbor for 5 minutes regarding the following prompts. What do you already know about hallucinogens? And how do you feel hallucinogens are perceived in society? Hallucinogens are found in plants and fungi or are man-made and are used for their ability to alter perception and mood. Examples of hallucinogens include LSD, PCP, and ecstasy. Some signs of use include dilated pupils, disorientation, heightened senses, or paranoia. These drugs promote neuroplasticity in the brain and often promote the experience of synesthesia, which is when you experience one sense through another, such as tasting the rainbow or seeing music. They also impact mood, cognition, perception, and decrease fear response. While often promoted as a strictly feel-good experience, they can often be unpredictable. Put another way, someone can have a positive experience that can quickly turn into a negative one. The effects of classic hallucinogens can begin within 20 to 90 minutes of taking them. Effects include intensified feelings, sensory experiences such as synesthesia, changes in sense of time, and at the same time experience an increased heart rate and nausea. So while their brain might be feeling good, their body could be impacted negatively, turning their psychological trip into a bad one. Dissociative drugs. The effects of dissociative drugs can begin within minutes and last several hours. Effects include loss of coordination, disorientation, hallucinations, as well as increased blood pressure and heart rate. Depending on what the person is experiencing, this could be pleasurable or scary. Psychedelics. Psychedelics are a subclass of hallucinogens that cause you to trip. LSD, psilocybin, peyote, mescaline, and DMT are just a few examples of those that have become popular in more recent years. Peyote and mescaline. Peyote is a small, spineless cactus. It is the active ingredient of the hallucinogen mescaline. It's often dried and ground into a powder to be smoked, or its buttons are cut off of the cactus, hydrated in water or alcohol, and chewed. Peyote has been used by indigenous peoples as a part of religious rites and medical treatment for centuries, and is legal when used by certified tribes. This means that a licensed medicine man or woman would guide participants through their experience, ensuring that it was safe and supported. This drug has a long-lasting effect that can actually stretch on for days. It produces a heightened sensory and dissociative experience, and users may have hallucinations, altered sense of time, nausea, dilated pupils, and increased heart rate. Psilocybin is also referred to as shrooms. Psilocybin is the active chemical in magic mushrooms, and there are more than 100 species of mushrooms that contain psilocybin. They are consumed by eating raw, often dried mushrooms, or drinking a tea made from them. Psilocybin is currently being researched as a potential treatment for a variety of mental health disorders, as the experience is often introspective, allowing users to navigate deep into their own thoughts and mind. Psilocybin causes a trip that can induce euphoria and last for more than 6 hours. Users can also experience distressing hallucinations, feelings of panic and anxiety, and increased awareness of environment. Ketamine is a dissociative anesthetic. It is used today as an anesthetic by veterinarians and in emergency medicine. It can be used to treat pain or mental health trauma. Tablets are taken orally, smoked, snorted, or injected. Ketamine impacts brain receptors responsible for learning and memory and can impact mood and happiness. High doses can cause clumsiness and a sense of detachment from reality, as well as hallucinations. This drug is popular in the rave, dance, and festival scene.
LSD, or lysergic acid, is consumed in tiny amounts measured in micrograms and is a liquid typically dropped onto blotter paper. This drug causes powerful alterations of mood and vivid hallucinations. A bad trip can result in lasting psychological trauma. MDMA is also referred to as ecstasy or Molly, and it has come in massive waves of popularity over the past 30 years. This drug actually sits in two categories, as it acts as both a stimulant and a hallucinogen, causing euphoria and increased connectedness. The drug often is used in the party culture to bring a warm, loving experience to the user, and it can have a lasting effect. Because of how the drug is manufactured, it is highly varied in what a person actually gets, and the drug is often mixed with other drugs. This drug was originally created legally in the 1970s to be used as a treatment for depression. It is continuing now to be researched as a potential treatment for mental health disorders such as anxiety in terminally ill patients and anxiety and depression in people on the autism spectrum. Phencyclidine, or PCP, is also referred to as angel dust, used via snorting, smoking, injecting, or swallowing. It is known as a dissociative drug, causing one to feel disconnected from reality. This disconnection from reality can cause someone to be extremely fearful. Dextromethorphan, or DXM, is a cough suppressant found in most cold medication and the chemical cousin of PCP. Young people know this and will take high amounts of it. Because the medication is legal, it's pretty easy for youth to access. Users can experience similar effects to marijuana or ecstasy, but because they've taken such a high volume of it, it can have some seriously negative complications, often requiring medical attention. The phrase bad trip is sometimes used to describe a situation where using the drug creates an intensely negative psychological response. During a bad trip, the intensity of the high can become extremely frightening or overwhelming. Risk factors for experiencing a bad trip include overconsumption or pre-existing mental health symptoms, or even just not being in the right place mentally for the experience. The physical experience is flushing, sweating, hypothermia, or a general inability to regulate body temperature, numbness resulting in further accidents, mixed nystagmus, which is the uncontrolled eye movement, rapid heart rate, and breathing. The psychological experience is violent, irrational, or self-destructive behaviors, confusion, and poor memory. When someone uses hallucinogens, it's best that they have a trip advisor. This is a sober person that can support the person through their experience, as often the user is detached from reality. A trip advisor should extend a calming, kind, and grounding support to the person, as well as monitor their temperature and keep the user hydrated. On the slide are harm reduction practices to think about. For more information, check out our curriculum guide or reach out to us for more content. Exit ticket. Practicing mindfulness can be an alternative coping skill to using hallucinogens. As an exit ticket, we're going to practice a mindfulness meditation. Sit upright comfortably, breathe deeply, gently close your eyes, scan your body, and notice any sensations. Notice your thoughts. When your mind wanders, focus back on your breaths.